Veterans who use smokeless tobacco face unique obstacles when they try to quit. It's not the same as quitting cigarettes, a difference many treatment options don't recognize. There's more nicotine in smokeless tobacco than in cigarettes, which can cause a stronger addiction and make it harder to quit. It can be even more challenging to find healthcare providers who are knowledgeable about the best ways to quit smokeless tobacco. Fortunately, VA providers have the tools to treat smokeless tobacco use and can help you build a plan to quit for good. Together, you can figure out a treatment plan to find the right combination of counseling and medication that will work for your specific needs. But that's not all. VA also offers the Quit Vet Quit Line smoke-free vet texting service and provides online resources like Smokeless Tobacco, a veteran's guide for quitting. Each of these tools provides support to help you stay on track when you're quitting. Veterans trying to quit smokeless tobacco don't have to go it alone. VA has the resources to help. Talk to your provider to learn more and get started.